welcome to Kate's Holistic Healing. I'm your host, Kate Fletcher, and today we have a very exciting show. As our regular viewers know, we've been doing holistic healing for about 3 years now, but this is the first time that we're going to do cranial sacral therapy. And I'm very pleased to have with me as my guest, Elizabeth DeLaBarre. Welcome, Elizabeth, and thank you very much for coming in.
Thank you for having me.
So, I guess the obvious question is, what in the world is cranial sacral therapy?
Well, cranial sacral therapy is a light touch manual therapy aimed at improving the structure of the body, especially the central nervous system, by eliciting the body's self-corrective nature. Now, what's that mean?
Right, does everybody, right, okay.
So, I brought my friend Dana Scully. You can tell when I got her. I think that we have the image and the body sense that the head is a helmet.
Right.
And the truth is, it isn't. I mean, it's hard because it's bone. However, each different colored bone has independent movement. So there's actually play.
But wait, I'm sorry. But when you're an infant, I know that your brain moves. But
And the skull bones.
and the skull bones, but as adults.
Yes, people learn that the bones are fused.
Right.
Now, this is kind of funny because we all know of Gray's Anatomy and Dr. Gray from the UK, and anatomists that are descendant from Gray's school worked on preserved cadavers. So preserved cadavers have more fibrous tissues between the bones, and there's very limited play. So that created the myth that these are fused.
And they're not.
And they're not, because Dr. Sperino in Italy and his anatomists and other countries in Europe and the Middle East, they know that these sutures are only fused in the presence of pathology. So many things in our culture based upon this myth.
That is a myth. And so what is the reason that they move? I mean, is there a benefit?
Okay, so well, I think the body has, we don't think about this because it's very subtle. The body has many mechanisms to increase and decrease tone in the body. So we have sympathetic and parasympathetic in our nervous system. That means we're more excited and we're more restful. We have our breath, we have the inhale, which is more excited and expansive, and the exhale, which is more restful and condensing. And we have the cerebrospinal fluid, which is produced inside the cranium and creates an expanding movement, and it's absorbed slowly and creates a condensing movement. And this movement can be felt anywhere in the body. I can feel it on your feet. Any skilled practitioner can feel it, not just in your head and your sacrum.
And what are you feeling? I mean, this isn't the circulatory system.
No, it's the production and absorption of cerebrospinal fluid, which bathes the brain and the nerves inside the stocking, the body fascial stocking that's around the brain, between the brain and the skull bones, and comes down your spinal cord, through the vertebral column, inside the bony column, around the spinal cord, all the way down to your sacrum and coccyx. And then that tissue is continuous with the respiratory diaphragm, with the diaphragm that runs across our shoulders, with the pelvic floor diaphragm. And so it speaks to how something that happens in your knee could possibly pull up into your pelvic half or your sacrum and pull up through your spine and cause a jaw problem.
Huh, that's fascinating because, well, medicine doesn't look at it that way. They think you have a knee problem, they look at your knee.
Right.
And so it is all connected.
That actually reminds me of a case with Dr. Upledger, and I apologize, I don't remember the Olympic swimmer's name. There was an Olympic swimmer who had a dive, and she actually landed on her knee on the cement out of the pool, somehow impacted her knee. She began having vertigo. She was unable to compete in meets. She was having a lot of symptoms. Dr. Upledger evaluated her and said, "What happened to your knee?" And then she told him of this fall, and working with the knee corrected what was happening in the vestibular system inside the temporal bones of her cranium, so that she was able to be symptom-free and compete. And I do believe she went on to win a medal.
That is amazing. So tell me, I mean, you mentioned that you can feel this movement and this flow of a practitioner. I mean, how do you do that?
So first of all, Dr. Upledger, he gave the world a great gift because it's because of his studies and research in the Michigan School District and with children with special needs and on the autism spectrum that he realized to do craniosacral therapy, you need good hands and a good heart. So I often describe to my clients, they want to know, they understand what I'm saying, but they still say, well, how does it work? And I read this a long time ago in an Ayurvedic text that when you cut your finger, the body knows how to heal, right? What do? We wash it, we keep it clean, we keep it covered so dirt doesn't get into it. But we don't have to instruct the body. We don't have to say, okay, start the clotting cascade, begin making fibrous tissue. It would clear the bacteria, white blood cells. It does. Our body knows how to be whole. And when I describe craniosacral therapy and I say it elicits the body's self-corrective nature, that's what I mean. You know how to heal. We need to support, right? So I'll evaluate, and I'm looking for this feeling in the body. And it's this tide-like rhythm. And I'm looking to feel this widening. If I'm on the feet, I'm looking to feel that widening and that condensing. And if I don't, I say, oh, there's some history here. Or there's some history somewhere else that's tethering this, which brings me to my next toy.
Oh, okay.
Once you have a question. So we often talk about, oh, well, so-and-so's getting older, it's only natural, they'll have arthritis or back pain or a disc issue,
Right, and
whatever.
just have to deal with it, and it's part of life.
And I think that paradigm is incredibly faulty because I feel, now, yes, we have human bodies.
Right.
They will show wear and tear and be vulnerable to injury and virus, et cetera. However, it's the accumulation of history and experience that is really what I feel contributes to aging. When we see someone who is pulled over to the side or pulled forward, there's experience that's held in the tissues that's creating that force. So let's say this is a body that's got good flow and it can expand and condense, but you sprain your ankle when you're a young child, and that subtle strain pattern affects how you use your right leg and affects that right side.
Okay.
And let's say that your parents get divorced, and because of the childlike mind thinking everything is their fault, you feel incredibly sad and grief-stricken, and it causes some constriction in your chest. And then maybe you get some asthma symptoms, or you're more vulnerable to bronchial conditions, and then maybe you have a horseback riding accident and you fall and you impact yourself on the side of your body. What's happened to our structure? What's happened to how well the circulatory system can function?
And how well everything can move.
Right,
It's
exactly.
now all tied up.
Right, so now there's immobility, there's stagnation of the lymph, of the blood, of the nerve communication. And so craniosacral therapy, now I have to figure out, I mean, that's sort of what we do. We feel, oh, what's pulling what? So you see how this side impact did something over to this side. And this heart strain, oh my goodness, I've created a puzzle I can't figure out. This heart strain caused something over on this end. And this ankle strain caused something up there in the shoulder, right? So when we're evaluating, I'll be on someone's feet and I'll say, oh, this right ankle has some history, and I can feel how it's related to something up here in the right hip or pelvic calf. Or I have many people in my practice who've come to me for knee problems, and it's because of the appendectomy they had when they were a young child.
No kidding. And now, how were you able to sense that in their body?
So I've got all the toys, Kate.
Perfect.
So as far as I'm concerned, this is the only way pantyhose should be used. Okay, so this is the occiput. That's the bone in the back of your skull.
Okay.
And this is your sacrum. That's the bone at the bottom of your lumbar spine. This is the coccyx. The coccyx is really deep inside, and most of us, unfortunately, are sitting on it, and we really need to get off of it to have good spinal mechanics. But this tissue here is the connective tissue around the brain and spinal cord called the dura that I was speaking of earlier. So when the dura expands, it, unfortunately, actually this person needs some cranial work because look, they're a little twisted in it. So there, that's better. So this will expand, and I can't demonstrate that since I don't have fluid inside. And let's say this person fell on their butt.
Right.
They slipped on the ice, they fell on their butt, and that sent a force up into their skull, and now they're getting headaches. Well, when I put my hand on their sacrum, there's not going to be any movement. And furthermore, when I put my hand there, my attitude, often when you see someone who does some sort of manual therapy, the attitude is, oh, this is really stuck, let's get it moving. Sometimes we do that, but mostly what we do is, it's as if my hand is saying, body, show me the pattern. And the body, or show me what's happening for you. It's really listening. And who doesn't love that?
No, that's, I mean, you have an area, we have an injury, and it's crying out for attention and suddenly getting it.
Right. So when you put your hand on the sacrum will not move because that shock, when that person fell on the ice, has inhibited that cerebrospinal fluid flow. It's inhibited that tidal movement, and there's no fluctuation. I should feel longitudinal fluctuation all along the spine, and quite a bit of it, over a centimeter. I mean, depending on how big the person is.
Really?
It is palpable movement if you have training. But this person who slipped on the ice and fell on their butt, no movement. Then,
so what can you do?
It will show me that it's pushed up into the lumbar spine and stuck there. And then this is what I mean by eliciting the body's self-corrective nature. I follow it. And the body, when something is restricted,
Right.
we no longer get, I'm pointing down here because I'm talking about this person's sacrum. When something's restricted, we no longer get the sensory feedback of the movement there to our somatosensory cortex, the part of our brain that's receiving sensory input. Right now it knows my hands are moving in this crazy way. So it's no longer receiving input.
Right.
That changes the motor output. It actually stops knowing that that's there because it's the movement, that feeds back the sensory.
And if it doesn't have that, then it doesn't know, so it can't, but then how can it know to heal it?
Okay, so I'm listening here, and the body says, oh, this is my crude translation of what the body's saying. The body says, let me show you what happened to me. And maybe it pushes the sacrum up into the spine, and maybe it turns the coccyx, and maybe it turns me a little bit. And then I know that person fell more on their left ischial tuberosity than their right, because there's this torque, right? And then that movement and the touch of my hand and the feedback goes up into the sensory system. And the brain says, oh, what am I doing over there? I don't belong there, because we all have an embryological blueprint. When the cerebrospinal fluid manifests is the moment in utero when the midline is forming in the embryo.
Oh, really?
So here I am on the sacrum. Here's my longitudinal movement I'm looking for, but the sacrum's doing that, and then the body says, what am I doing over there? And it starts sensing, that's not where I belong, and I might put a hand on the lumbar spine so it can actually feel, oh, that really got compressed. The body doesn't like feeling its tension.
Right.
You'll notice this just with something simple. If you're uptight about something and then you realize, oh, my shoulders are up to my ears. Oh, I don't need to do that, right? As soon as we are aware, we realize we can stop.
Exactly.
It's the same with the subtle movement. The body suddenly feels it's compressed and in a left rotation, and that's not its blueprint. And it starts releasing the adrenaline that has been stored in the nerves from when that impact happened. You start getting real tissue change, softening, heat discharge. People will say, oh, I feel that down the nerves in my down the nerves of my leg.
Yeah.
All this discharge happens. The tissue spreads. The body starts moving towards midline and reorganizing itself.
And it does this simply with you
Supporting it.
finding what direction it wants to go in, and just...
Exactly. Now, sometimes something's really stuck. Let's say this person, and sometimes, let's say this accident happened with someone who already was really tight in their body. I may give it a little nudge. I may actually compress it a little further so it can feel. And it really depends on the person. There are people who are really sensitive, and just being with the fluid movement that is in the rest of the body, not here, but elsewhere, begins to make enough flow that the body actually just does all the work itself. And it's really, there are different schools of craniosacral therapy, and different practitioners use the techniques differently, and it really depends on the person and what they bring. I feel that mostly I'm a support, and occasionally I reach into my toolbox and do a little something, because it'll save that person months of, if I am only being with and supporting it, the body will find its way, but it may take a very long time.
My, it's just such an interesting concept that the body knows what it's supposed to do, because you're right, the finger can heal.
Right.
So we know the way we're supposed to be in, but it doesn't, but why don't we fix it on our own? Why do we need an intervention, the cranial sacral therapy?
Because I think
The time?
we can get stuck. So this person who fell on the ice,
Yeah.
that created an area of immobility, and some people have a lot of vitality. Their cerebrospinal fluid, they feel like the ocean at high tide. It's very powerful. And some people, it's very light, and those people maybe need a little more support to move through something. But some people will move through it on their own. Some babies, after they're born, their head will expand and reshape, and no problem. And some babies, first of all, maybe they have more intervention, and they really need extra support. It's very, very individual. But I think it's a paradigm shift for us to think, one, that, well, I'm functional now, so that sprained ankle, I can walk around, so it's fine. It's not fine. You need that force that came in to be removed, to be erased, for your body to rediscover its subtle movement. This person who fell on the ice may have a sore lower back, but eventually they'll get used to it, and then that will create faulty movement patterns that leads to what we call aging.
So people that are walking around with chronic pain, and they just figure, well, I have to live with it because I've got a bad back, I've got a bad knee, hip, whatever.
It's not true.
It's not. They don't have to live with it.
No.
And the medical community might tell them, well, there's nothing else we can do surgically to improve this.
Actually, what I'd love to see is for people to try something like this, or perhaps craniosacral therapy, or visceral manipulation, which is mobilizing the organs, or Rolfing or structural integration, or even acupuncture, although that's a little more indirect because it's such an energetic modality. It doesn't have as much of a foothold in the structure, although it can affect the structure. I would love people to try something like that, or some of the other things that you've talked about on your show, before they try medication and surgery. They can always go to that if this isn't effective. But I have a very busy practice, and most of the people I know who do this work have very busy practices, and that's because it's effective. And knock on wood, I don't advertise, it's word of mouth. This person gets help with their herniated disc. I've had people come to me, one session, their herniated disc is gone. One session, their bladder incontinence is gone. Now I will say that doesn't always happen, and it really depends on what else is going on in your body and your mind.
Right.
But it's an effective modality.
Well, and how does the mind come into play with it? Because you said you have to have the right thoughts as you're working on a person. But do people, can we get in our own way?
Well, I find that people will say, well, what if I don't believe it or I don't feel it? Will it still work? And it will. But I find that the mind, if your mind is in a state of black and white and kind of holding tightly to your belief system, that affects your system, your body system, your fascia. It creates more tension and more tone in your tissues. than if someone who says, okay, I trust that I'm on your table because this can support me and assist me in my healing. That person has a totally different, they're less acidic, their tissue, and because they're less acidic, their tissue tone is softer, more pliable, and sometimes they have to participate. Sometimes people will come to me for left hip pain. They have a short left leg, and I'll say, well, this is a consequence of something going on in your small intestine, because the small intestine, I don't know. Let me use a different example. Let's just pretend this is my small intestine. So the small intestine is tight and inflamed, and the fascia around the small intestine is pulling down into the leg, and it's shortening that left leg and drawing that thigh bone more tightly into the socket. And so that person will develop arthritis in that, or actually maybe in the other side, because then they're coming down really hard on the other side. It could go either way. And I'll say, well, I can get it moving, and they'll stand up and they'll be confused because that left leg will hit the floor sooner because it's longer, but then it'll come back. And then I need their participation in thinking about what are they eating, what are the emotions going on, because we all know the gut brain, there's all this research now of how our emotions may even come from there, right? But certainly it's responding to what we're feeling. There's this dance back and forth. So I then require their participation, and that's why I say the mind, because if someone isn't willing to look at dairy or gluten or sugar, if they've got a chronic yeast problem, and they may not, it may not show up digestively. They may think, oh, well, things go okay down there, and but they have back pain or they have hip pain. And that's the way the body's communicating that something is off in the digestive system, and people don't know. So I need a certain amount of open-mindedness sometimes in the client if they really want to move forward.
Yeah. Well, I guess that's true in a lot of different modalities. I mean, if you, unfortunately, we're convinced as young kids that doctors are these knowledgeable people, so you go to them and you've got some faith that something's going to work. But I could see in a modality that, it's not one of the major ones. It's not like Tai Chi or something.
It's still on the liminal aspect of people just don't know about it, of what we're exposed to. Actually, I'm very grateful to our physicians. They do life-saving work. I do wish that they would inform patients that somewhere after they have post-operative clearance, maybe it's somewhere in that 4 to 8 week window, post-operatively, that the doctor would say, now it's time to get some body work. Find someone who does some sort of manual therapy to restore the subtle movement. Because once that scar, the body does such a good job, right? It knits back together, and then you've got this area of immobility, and that begins pulling things towards it. It's this, right? Anywhere in the body that isn't moving is like a magnet, and it slowly pulls things towards it. And then before you know it, your appendectomy is causing a disc issue, or tension in the right sacroiliac, or a knee issue, or pulling up and doing something to the spine or the clavicles or the cervicals, and therefore the temporals and the occiput shift, that's these bones and bone and back, and then your jaw is up the crick. Let me actually explain that, because this many of your viewers, this is, and many of my clients, people come to me, and thank goodness, they'll say, my dentist said to find someone who does craniosacral therapy, which is a wonderful thing that they're now referring, because they realize if you work on the mandible in isolation, it doesn't work a lot of the times. So the mandible is one bone, but
it's your jawbone.
It's your jawbone, thank you, be my translator. But it's got a socket on each side in these bones on the side of your head here. So that person who fell on the ice and that impact came up into the occiput, and it torqued the occiput also, because the occiput will do what the sacrum does. If something happens down here, the occiput has no choice but to be a mirror, because we need our eyes level with the horizon. There's all kinds of writing reactions that we have that the body will just do, and you won't even know it. So then the occiput pushes these bones. And now the sockets, where this bone goes into, instead of being like this, which would give you a nice swinging mandible, they're like this. What's the poor mandible to do? How will your jaw ever be happy.
Right.
It can't be. So many times, when we talked about the knee, a jaw problem is not a jaw problem. I'm aware of a client who said, Elizabeth, I think this is my 8th session, and I came to you for TMJ dysfunction. You haven't touched my jaw once, but I no longer have jaw pain. Because it was about her pelvis.
Right. That is fantastic. So what happens if people are having issues, which most people do, how can they get in contact with you?
Well, with me personally,
Yes.
my website is creativehealthsite.com, creativehealthsite.com, and internationally, you can go to upledger.com, that's the Upledger Institute, and they'll send you to a link where you can find a practitioner. And then also there's another school of craniosacral, and I believe it's craniosacraltherapy.org to tune into the biodynamic school and those practitioners. And really I would try different practitioners and different schools because they all have benefit. And you may need different types of therapy at different times for different issues.
Right. Well, I know I had come to you and you were helping me with my back and my liver issues.
Correct.
And it was very effective. And I have to say that if you do have troubles and you are thinking about this, then you should give Elizabeth try to reach out to her.
Thank you.
And I want to thank you very much for coming on today and explaining to us everything about cranial sacral therapy and all this movement we have inside of us, and I'm sure most people didn't know.
They probably didn't, and they do now. I'm very grateful to you.
Yeah. Well, thank you very much, and thank you all for tuning in, and we'll see you next time on Kate's Holistic Healing.